What was the scariest part of being involved with the insurance industry for you?
The scariest part for me was starting to speak out against the industry that I worked for, that I was a part of for 20 years. It was enormously difficult for me to finally reach that point of saying, I can't just sit still, I can't stay on the sidelines. But I ultimately felt it was more important for me to do that, knowing that there could be some retaliation or something down the road that might be harmful to me and my family. I just felt this may be the only chance I have to do something really important, so I decided to do it.
Did you receive death threats?
I have not. I have not. I've been lucky. You know, honestly, I thought I might. You think the worst when you when you think about doing something like this. You think of all the negative things rather than the good things that can happen. And I've been blessed. I've been fortunate that I've gotten so much support, so many good wishes, and support also from a lot of my former colleagues who haven't taken the step that I have, but they still called and said, thanks for doing what you're doing. It's been very rewarding.
So what is the response from the higher up when you all would get calls from people complaining about having their coverage dropped, or having something major, like major surgery not being covered? Like, did you all just like turn a deaf ear?
Well, it depends on how you learn about it. If someone is being wronged, if someone is being denied coverage, what I would encourage people to do is to let the news media know about it. Try to get a reporter or a producer interested in doing something about your story, or telling your story. Call your senator, call your congressman, call your state insurance commissioner, call somebody who might be able to help you out, and be the squeaky wheel. Be someone who is not going to just sit by and let them win. In many cases, we're talking about life and death situations, so don't accept a denial as the final word. Do something about it. Start getting the support you need to try to get a denial overturned.
What's the problem with insurance companies? Why are the insurance companies having a problem with the public plan in general? I mean, don't you all sell more plans that have vision and dental compared to basic?
Yeah, the reason they are opposed to a public plan is they don't want to have a new competitor. The insurance industry has been consolidated over the last several years. There have been a lot of mergers and acquisitions, and you have far fewer competitors in the business now than you used to have. So they don't want, number one, to have a new competitor. Secondly, it would be a competitor that would operate on a non-profit basis. It wouldn't need to send a lot of your premium dollars, if you enroll in a public plan, to Wall Street investors. So that concerns them. They would have to behave differently. They might have to accept smaller profit margins. They could exist, they could operate very profitably in competing against a public option. They just don't want to. They want to capture all the new revenue that they possibly can in a reformed healthcare system.
Anything else you'd like to say?
The only thing I would have to say I would add is that I encourage people who understand the importance of healthcare reform that they themselves get active and become activists. I'm not asking people to do what I'm doing, but do things like talk to your friends and your neighbors, tell them how important it is. Write letters, make phone calls to your members of Congress, your senators, write letters to the editor. Just make sure that your voice is heard. Just because we might have voted for a president who's for reform or members of Congress who are reform, that's not enough. They need to hear from us as every citizens that we are behind them and we expect them to do the right thing.
Do you think we're going to have a public option this year?
I do. I'm very optimistic, and I'm telling people, and I believe this wholeheartedly, it's always been a lie. The insurance industry is perpetuating the notion that it is not. They've even said it's been dead. It never was, but it's part of their tactics to try to discourage advocates of reform. It's very much alive. It's going to be in the House bill. It probably will be in the Senate bill, and when they merge the two bills, I'm absolutely certain it'll be in it.